Many communities in Oklahoma, in rural Oklahoma in particular, do not have physicians there. And rural Oklahoma is very important not only to Oklahoma, to our economy, but to the United States from an agricultural standpoint. And so having physicians in those communities so people can live there, be healthy, farm, participate in agriculture is very important. And so what we're seeing in rural Oklahoma is that people are not as healthy, we're not living as long, the cost of health care is higher there because we don't have access to preventative health care in rural Oklahoma. Our mission at the OSU Center for Health Sciences is to provide primary care physicians for rural and underserved Oklahoma. We really believe in our pipeline programs of finding the right students and being mindful of the way we train them and training them in rural Oklahoma where we want them to practice and stay.
You need somebody that grew up in rural Oklahoma, understands rural Oklahoma, wants to serve in rural Oklahoma. That's the student that will go through the process, become a doctor, and go back home.
What we're finding is you really can't get to them early enough. The thing you have to get over is convincing them that they can actually see themselves in something big.
In the FFA program, our Blue Coat to White Coat program is really about identifying students who already embrace the rural lifestyle. They live in those communities, they understand leadership, they understand hard work, and they understand commitment to community.
And when you think about the motto of FFA, it's learning to do, doing to learn, earning to live, living to serve. That's the motto of an FFA student, a student leader in FFA, but it's also a very fitting model for a student who might pursue a career in family medicine.
We started with the Blue Coat to White Coat program in the FFA, and that was such a success that it seems like a natural fit that the next place we go is Oklahoma 4-H. These are the rural youth across the state, and we know that this will allow us the opportunity to engage with them even earlier than high school. Oklahoma 4-H has nearly 15,000 members ages 9 through 18. They're able to have a passion for their community, and when they graduate, there's no question they're going to go back home.
So I grew up in Medill, Oklahoma. It's just a small town down by Lake Texoma. Being in 4-H and FFA when I was growing up, it made me a lot better at being able to interact with people and making sure I was responsible for different things and getting projects done on time and being interactive with people across the state that I may not have had things in common with or may have had tons of things in common with. And I've maintained a lot of those relationships up till this point, which has made me successful in my college career and my medical career, because those people will eventually be my patients, people that I've maybe known forever or have a connection with that way.
In order for a medical student to go through medical school, the debt burden was tremendous. When a student is facing that sort of debt after going through professional school, it really limits and funnels down their choices for what they choose to do and choose a residency in and what they want to specialize in. They start thinking in terms of what can make the most money, and they start thinking in terms of urban practice areas.
When you grow up in a small town, you don't think that you can achieve those dreams. You're scared. You're from a tiny town with not a lot of resources, and you can't see how it's even possible for you to achieve those dreams. But scholarships makes that possible. I can go back into primary care or whatever specialty I choose and not have to worry about paying back huge medical school loans.
I'm going to be able to practice medicine in rural Oklahoma and stay involved in agriculture all at the same time, and I think that's an incredible thing about this school is that you can achieve your dreams even if you're from a small town like Medill, Oklahoma.
If Audrey Hendershaw was here today, I would tell her thank you. Thank you for supporting me and believing in me so that I could chase my dreams. I'd also tell her thank you for supporting future 4-H and FFA students who want to pursue medicine. You're giving them the same hope that they can follow their dreams that you've given me all these years. Thank you.